Hey guys, it's Stephanie here, and tonight we're going to have a conversation about ADHD. So what we're going to do is we're going to take a little quiz and I'm going to test your knowledge. So, well, what do you know about ADHD? Do you know a lot? Do you not? Maybe you'll learn something new. So we're going to take a quick quiz and then we're going to go over the answers as we move along in that quiz. And then we're going to just talk about what ADHD is and a little bit about how we diagnose ADHD, and that's kind of pretty much all we're going to do tonight. And then next week we're going to add to the conversation about ADHD, so I'm going to give you weekly videos to just continue to add more knowledge about what we know about ADHD and how to help kids who have this diagnosis. So this video would be great for teachers and or parents that have a kiddo that has ADHD. Okay, so let's get started. All right, so the first question on the Quiz Your Knowledge is ADHD and ADD are different conditions. True or false? All right, so ADHD and ADD are different conditions. The answer to that is false, and we're going to talk about that in a few minutes. All right, let's go to number 2. ADHD is one of the most commonly diagnosed neurodevelopmental disorders. Again, the answer is true or false. Okay, the correct answer is true. It is the most commonly diagnosed neurodevelopmental disorders. We used to think about ADHD as a behavior disorder, but over the years, there's just been so much extensive research that has been done and is continuing to go on in regards to ADHD. So there's a lot of new information and there's just a lot to learn. So again, it's a neurodevelopmental disorder and it is the most commonly diagnosed condition in children. So the CDC did a recent report, and in that report, they stated that 3 to 5% of the student population is diagnosed with ADHD. So it's estimated to affect 3 to 7 out of every 100 school-aged children. And that information comes from the American Psychiatric Association. All right, number 3. What percentage of children diagnosed with ADHD will continue to have ADHD symptoms in adulthood? Is it A, 20%, B, 50%, C, 60%, or D, 90%? What do you think? The answer is 60%, and this information came from a recent study done by the Cleveland Clinic. So 60% of children diagnosed with ADHD will continue to have symptoms in adulthood. Number 4, executive function deficits are key factors in the everyday difficulties faced by children and adults with ADHD. Executive functioning affects how people A, prioritize tasks, B, organize time and materials, C, control emotions, D, manage thoughts and actions, or E, all of the above. The answer is all of the above. Question number 5. ADHD is easy to recognize. True or false? Surprisingly, the answer to this question is false. So, ADHD is easy to recognize. No, it is not, and there's a lot of reasons behind that, and again, we're going to talk a little bit more about that. And it's really important that when we're looking at a possible diagnosis of ADHD, that assessment and evaluation is very comprehensive. And we'll again talk about that in a few minutes. Number 6, ADHD is more commonly diagnosed in A, boys, B, girls, or C, diagnosed equally. The answer is A, boys. So for every girl diagnosed, there are between 3 and 7 boys who will receive an ADHD diagnosis. So why is that? Well, there's a couple different reasons for that. So more girls with the inattentive type of ADHD sort of get written off. They get written off as daydreamers or maybe perhaps a little bit flighty. And girls often tend to work really hard to compensate for their weaknesses and try to hide those weaknesses. So oftentimes girls are diagnosed a little bit later. They're a little bit older. So those are some of the possible reasons for that. Number 7, although the exact causes of ADHD are unknown, all of the following are considered possible causes except A, genetic factors, B, chemical imbalance in the brain, C, poor parenting, or D, smoking during pregnancy. Okay, so they're all considered possible causes except C, poor parenting. So the diagnosis of ADHD has nothing to do with poor parenting or poor parenting skills. It is a neurodevelopmental disorder. And surprisingly, there are many people who believe and think that. I've heard many people say that. And it's just frankly not true. And that's why it's really important to gain some knowledge and information in regards to ADHD and kind of understand that there's a lot of new research and a lot of new information in regards to this and this diagnosis. Okay, number 8. Now this is the last question. Medication is recommended as the primary therapy for ADHD. True or false? The answer is in fact true. And the research supports that it is the primary and most effective treatment for ADHD. So according to the National Institute of Mental Health, research supports this treatment as most effective. Okay, so let's talk a little bit about what exactly is ADHD. ADHD is a complex brain disorder, not a behavior disorder. That's kind of the old train or the old school of thought. So how do we know this? Well, we know it because of the research that has been going on for the past 20 years. So we know that neuroscience research through brain imaging and clinical research shows us that ADHD is a developmental impairment of the brain's self-management system, its executive functions. People with ADHD have difficulty with global self-regulation. So what does that mean? Well, we know that the ADHD brain is affected. There are several different areas of the brain that are affected, and there are different parts and networks that are interrelated, okay, around things like emotion, attention, behavior, and arousal. Lots of experts argue that ADHD should be called attention deregulation. I tend to agree with that. I think that that would be a better label, and here's why. Most people with ADHD have more than enough attention. They can't. Well, here's what happens is they can't couple that attention in the right way with consistency. Hence, we interface with a student with ADHD who can become hyper-focused. So if you are a teacher or a parent, you will see this. So a kiddo with ADHD can actually become hyper-focused, so super focused on something that they're really interested in, and they can do it for hours. So they're so focused that they lose all sense of time and what's going on. So I do think that definition would be, much better. And maybe someday they'll change it. Who knows? So let's talk about. So we talked about diagnosing ADHD. So within ADHD there are 3 subcategories. So let's talk about those. So we have primarily hyperactive or impulsive subcategory. We have the primarily inattentive type, and that was formerly called ADD, right? So it was the attention deficit minus the hyperactivity. So that's the second subtype. The third subtype is a combination of the 2. All right, so let's break those down a little bit. So the hyperactive impulsive. So this subtype, what are those behaviors, and what are some examples? So when we see a kiddo perhaps moving and squirming, a kiddo that's super impulsive, very impatient, a lot of talking in inappropriate times when they should be quiet, interrupting, a lot of interrupting, difficulty waiting their turn. So those are some examples. So inattentive type, what are some behaviors that we might see? These are the kiddos that are distracted, they're forgetful, they're often, we consider them daydreamers. They lose track of lots of things, so they may lose track of their homework, books, things they need for school, cell phones, keys. They lose track of conversations often, so they could be midstream in a conversation and they forget what they were talking about. So, we can probably think about ourselves, and, I can think of many times where I've kind of lost track of a conversation or I've misplaced my keys. So this we're talking about, this is like repeatedly over and over. It's happening all the time. It's more than what would be happening with the average kiddo. And then we have the combined type, which is a mixture of both categories, right? So a mixture of symptoms. Okay, so when we think about the DSM-5, there's detailed criteria in there for diagnosing. And here are some of the things in the DSM that we clinicians must look for. So in each subtype, there are 9 symptoms to look for, and a kiddo has to have at least 6 in a category, 6 symptoms in a category. They have to have been noticeable for at least a 6-month period. Okay, and these symptoms must interfere with functioning, with a kiddo's functioning and development, and have been apparent before the age of 12. Okay, and these are across settings. So it's in school, it's at home, it's with the family. We can see this symptomology across all settings. It may be heightened, right, when a kiddo is expected to perform more tasks and so on and so forth. That's why oftentimes kiddos are not diagnosed before they're in school. But those symptoms have to have been present before the age of 12. Here's the thing, so when we're talking about diagnosing, remember in our quiz, so it's estimated that 60% of people with ADHD have one or more coexisting conditions. So this means that 60% of kiddos that have ADHD, there's other coexisting conditions, and those could be things like mood disorder, depression, anxiety, conduct disorder, and that's just to name a few. So they could have one or more coexisting with the ADHD. This is why a comprehensive assessment is very, very important. So part of that assessment, you really should be having a neuropsychological testing, a medical history, rating scales that go to the teacher and then home, and then those are kind of compared. What you don't want is for the pediatrician to send out those rating scales and then place a diagnosis on your kiddo just from doing that one assessment, because that's not, we have no idea. You need much more to figure out, to look at the whole child. So make sure that you have a comprehensive assessment. Very, very important. So we talked about medication. So stimulant medication is most recommended. And again, you might say, well, why? Well, because the studies show that it is the most effective treatment. Now, medication paired with CBT, now that's a type of research-based therapy. So CBT stands for cognitive behavior therapy. I use that a lot with kids that I work with that have ADHD, kids with anxiety. It works really well as well, depression. So if they're having, again, some of these coexisting conditions, that form of treatment is going to be really, really helpful to teach some self-regulation strategies and to start working on our thinking. And because CBT really goes into a lot about how our thinking affects how we feel, and then essentially how we behave or act. Excuse me. Sorry. But anyways, I'll get into more detail about that type of therapy in a different video. So another thing quickly, here's the thing. Let's think about exercise for a minute. So we know that exercise increases dopamine levels, which increases our attention systems for everybody. Excuse me. So, and we know that that's kind of in short supply for kiddos with ADHD. So exercise is a really, really effective strategy to use with kids that have ADHD. There was a study done in 2015, and in the study what they found was 30 minutes of exercise before school can help kids with ADHD focus and manage their mood. This could decrease some of the need for stimulant medications in children. So I think that's really important information to know. It's important for parents. It's important for teachers, because if we know this, maybe we need to incorporate some exercise at the beginning of our day. And here's the deal. It's going to help our entire classroom. And it's going to help those kids that have ADHD. And it wouldn't really single them out either. And if we know that as a parent, then maybe we can incorporate some form or type of exercise before they even get to school. So anyways, that's a little tidbit, but that's all we're going to talk about today, because I don't want to overload you with a ton of information. But stay tuned, because what I'm going to do next week is I'm going to talk about some hidden layers of ADHD, some things that kids struggle with besides, the typical on the surface symptoms that we talked about. There's a lot of hidden things that are going on with kids with ADHD, and it's really important to understand what those things are so we can best help and support our kiddos, not only at home, but of course at school, because school is a really tough place for kids with ADHD. So we're going to talk about that and some tools and strategies that teachers can use, some accommodations that would be really helpful to really support our kids that have ADHD. And it's important for parents to have that information too, because remember, you are your child's advocate. So it's important to understand and know what those accommodations are, so you can collaborate with your kiddos' teachers and make sure that those things, those accommodations are happening for your kiddo. So we're going to talk about that next Tuesday, and then we're just going to kind of continue adding to our discussion, because there's so much to talk about. But that's all we're going to do for today. So I hope you found this video interesting, and I hope this information is helpful. And if you found it helpful, then I would appreciate a thumbs up. And don't forget to subscribe and come back next Tuesday, and we're going to continue our ADHD conversation. So don't forget to be kind, and until next time.